And first, to lead us off with is healthy community. When we talk about connecting with international missions, we talk about charitable missions, you cannot do it without the Healthy Community Program. And this particular program is led by Dr. Peter Chen, who we have the pleasure to welcome, and him and his team will present our Healthy Community Program. Dr. Chen?
Of TIMA USA? No. Sorry. Huh? USA? 他讲话我完全听不懂。
有画面吗？
我已经重启过了。It sounds okay. It's a lot of echo. A 真的谢谢。
Brother Ming, I think you may have to turn off the speakers on Dr. Chen's computer.
Testing. Can you hear me? Still have some echo. Okay. Sound. Sorry. There's a lot of echo. Should I turn this off? Turn this off?
电脑的 speaker 也要关掉，因为它麦克风已经关掉了。OK。
Testing. Can you hear me? Is okay? All right. Ladies and gentlemen, a friend of the TIMA USA, and a lot of honorary guests on the line. And I myself named Peter F. Chen, MD. I'm a long-term surgeon, also the GI endoscopy for almost 40 years. I joined the Tzu Chi Foundation in 2003. Since then, every single year of the TIMA annual meeting, I fully attended. So I'm very proud of myself. For my age, I do some of the slide show. For 79 years old, you had to be part of me if anything wrong, okay? Now, today our program is primarily for the healthy community. And we try to divide the healthy community program into 3 or 4 sections. First of all, we try to review what is the healthy community? Everybody had a vision, everybody had a mission, everybody had a goal. But here, a couple of things I want to point it out. So we didn't have a screen, huh? Okay. Primarily, I want to go to physical, emotional, and also spiritual education. And the last column of the goal, 4 major items are very, very, very important. That means healthy lifestyle, plant-based diet, physical exercise, and stress management. If everybody can do this, fulfill to do these 4 tasks in your life, you will be a very healthy and happy person. Now, this is the program. Don't look at the 2 old men above. They are very old, including me. For the 5 young generation, Nancy and Dr. Koo, Ming, who is the video production, and Monique, who is a very good coordinator, as well as Yuming Cho, who is a PhD of UCLA. They are done, we carry our torch for the next many years to go. So I will divide the today's talk in 4 major sessions. First of all, the Healthy Community Program. We started this program really almost 10 years ago, but at the beginning it's not very organized until 2016. I want to show you some video clip. This we edited by Ming and also by myself. Pardon me if anything did not go like you wish. So let us view some of the clips and about healthy program. Retire life, health fair, and health talk, free consultation, the circuit talk in the community and university, liver cancer, how to take good care of yourself in winter time, and all different topics. There's dental care, and we talk about how you plan your estate before you die. We try to cover all the aspects if we could. These are the regular schedule that we had performed in our office in Alhambra. Besides that, in the community, I have been went out for many, many times. And up to now, it's the number 83rd time I go out to talk. And I try to reach for 100. I do not know how many years God will give me so that I can fulfill that. Now, there's a mooncake festival a few years ago. But this is Nancy Chen, he's our coordinator. And esophageal cancer. You see a lot of my picture in the clip because I had to be there. I'm a host, and also a lot of time I serve as interpreter or translator, you will say. The hepatic pancreatic cancer. We went to the beginning of the 2019. Brain tumor. Some of the speakers even did not speak any Chinese. So I had to translate it. Diet. Here is Dr. CEO, our CEO. All right. So the topic of our health education, we make this diagram is very good, divided in general, 4 categories. General topic, the topic we deal with the traditional Chinese medicine, and also the cancer awareness program, as well as integrated medicine, which especially the cancer awareness, we will another session, we're going to talk a little bit more detail, as well as the integrated East and West medicine. So we'll see that. You see that 4 or 5 years? So how many we so well distributed? Remember that when you look at the right upper corner, the pie, the biggest pie is we are talking about healthy lifestyle. As long as you can maintain a good, healthy lifestyle, according to the Harvard University Public Health, the published article in 2016, you will cut down the cancer rate of 40%. And you can increase your life survival of all kind of patient average about 50%. So we all covered in the bottom part is the health education, the number, how many times, as well as the community health fair. Now, do we get the next step now? Because of the Ming was on board, so we had the television so that we can broadcast it in the far advanced and also far reach more remote areas so people can review. Now, this is a 2020, and because of the coronavirus, so we changed the way what we produce of the talk. The advantage of the old one is the lecturer and the patient direct face-to-face communication. It is a new way with the telemedicine. Disadvantage is the one we cannot talk to the audience directly. But you can reach more people. People can watch the video in your leisure. This is the Tai Chi. DC is very good. Tell the audience what kind of medicine why you're there. Okay, next major program is our cancer awareness program. I was very fond of this. It is a program. So we launched in 2016 to set up this. We tried to set up a regular every bi-monthly. We had an expert to talk about what kind of topic of all kind of cancer. Why I want to do that? Because when I attend American Cancer Society, American College of Surgeons meeting, we get the information. For the average United States screening for the colon cancer at 50 years old, in 2010, only 62%, but 2016, up to 67%. In 2018, we tried to reach 80%. Now look at that, our Chinese or Oriental immigrant in the United States maintain about less than 40%. That is very sad. Whose fault is this? Our fault. We medical professionals did not get adequate information to the public. Now, we cancel awareness program, so everything go with education, education, education. The next thing is we do the practical thing for the screening, not only the PSA for the prostate, but the fecal occult blood for the colon cancer. Hopefully in the future, we can do the cervical cancer, the screening, as well as mammogram. Now, we try to teach the people get the cancer beforehand. After you get a cancer, we try to do all kinds of support for the patient as well as family, as well as their family. And because when you had a cancer in the family, is everybody will be involved. Now, this is how many, we had a 24 lecture. You can see that the all kind of cancer was involved already, except bone cancer. We haven't got a good speaker to talk about that yet. Now, 2021, what are we going to do? That's what we try to plan for the year. Because of the social media, hopefully we can utilize the social medicine so that we can get more broader base of the audience. And because like I mentioned, because a lot of the people, they did not have time to come to meeting, but in the afternoon, if you have time, you can turn on the television or whenever Facebook, they can watch our program. And also we hopefully establish CIMA USA, the education, the activity database, because that is very important for future if we want to apply for a grant. I also establish health education resource center, so we can refer, they can refer to us. And my vision, I would like to get all the 核心区 9 area, everybody can have their own healthy community program. That's my goal. I don't know if I can do that or not. And with the help and our clinic, so we can educate the people, especially under the guideline for the FQAC, so the doctors can tell the patient if you had the hypertension, which date we had this program, so you can go to attend that meeting. Now, next topic, we'd like to introduce you the good-looking, the young, energetic Dr. Ricky Chang, he is the community fellow for the UCLA Center of the East and West Medicine. He'd like to tell us about what is all about integrated East and West medicine. Dr. Ricky Chang.
Thank you, Dr. Peter Chen, for welcoming. Hi, so my name is Ricky Chang, and 我中文是张安志. So I'm here to introduce you to you guys the East-West Medicine Project. So this East-West Project is a collaboration between UCLA Center for East-West Medicine and Tzu Chi Medical Foundation. And I'm very grateful and honored to be working and represent both organizations. Currently, I'm the physician leading this East-West project. And at the same time, I'm training as a community fellow at the UCLA Center for East-West Medicine in order to bring over and implement the East-West clinical model at Tzu Chi clinics. Our mission is to improve the health and quality of life by bringing together the best of Western and Eastern medicine. And we aim to provide healthcare that is safe, effective, humanistic, affordable, and accessible for everyone. And in this slide, you can see that by serendipity, the first clinic opened at UCLA Center for East-West Medicine was established in 1993. And it was the same year that Tzu Chi's Alhambra Clinic was opened. And since 2018, UCLA and Tzu Chi has been collaborating on different events and conferences, as you can see in this picture. And then in 2019, we were able to celebrate the center's 25th anniversary in Beijing. And Dr. K, along with Mary and Nancy, were able to join this momentous event in Beijing. And here's a picture of me learning East-West medicine with Dr. Laube, one of the faculty members at the Santa Monica Clinic. The center has created a successful healthcare model that has improved the lives of tens and thousands of patients. But we want to disseminate this model beyond the academic center to the underserved community. And currently at UCLA, there are 4 East-West clinic sites, one in Santa Monica, one in the South Bay areas, Torrance and Palo Verdes, and also in Westlake. And we also have a newly established inpatient program at the Santa Monica Hospital since July of 2018. And here's a picture of Dr. Kakehui. He's the founder and director of the Santa Monica East-West Medicine Clinic, and along the other faculty members at UCLA, which I get the pleasure to work with. So you asked, what is East-West medicine? So the main goals of East-West medicine is to use the best of East and the West to provide safe and effective way to treat each patient. It is individualistic and patient-centered model to provide humanistic care, which is the vision of Tzu Chi as well. And more importantly, we want to provide care that's accessible and affordable to everyone. And I want to introduce you to the Tzu Chi team that we are on board. Dr. Peterson has kind of recognized some people already. So on the top corner, it's led by Dr. Kakehui and Dr. William Kay. We also have Nancy as the lead administrator on the project, me, Anna Fong, which is the project manager, along with Wei Jing, Kevin Wong. And on the Tzu Chi side, we have Dr. Ku, Dr. Peter Chen, TC, Dr. Lai, Richard Chang, and Dr. Yuming Cho, who's also part of the Community Healthy Clinic. So in the coming years, we aim to develop an online training course. We want to train everyone from all walks of life. This includes doctors, nurses, nutritionists, to social workers, as well as physical therapists and primary care givers. We also envision to build a new teachings resource center and start an East-West clinic within the Tzu Chi clinical sites. Up here, introduce the project. If you guys have any questions regarding the East-West clinic, you're welcome to contact me. Here's my contact information along with Nancy and also Dr. Peter Chen for the Healthy Community Project. So now we'll give the mic back to Dr. Peter Chen. He will conclude our talk.
Yeah, they said I had the 10 more minutes to talk. I was thinking, what are we going to talking about? If for the old man, you see how I'm bending down, it's so slow, but forgive me about that. And I'm very, very fun to talk about lifestyle. 2016, I just mentioned your university, Harvard University, the public health service published about 17,000 young people follow up for a long time. He come to the conclusion is that healthy lifestyle. So what do you call a healthy lifestyle? Number one, abstain completely smoking. Number two, the drinking for the good red wine for women, one day, one ounce, one glass, and the men allow have 2 glasses. Number three is the adequate exercise, about 30 minutes per day, 5 days a week. And then the last thing is maintain your BMI. Hopefully maintain the about 18.5 to 27. Of course, this is the Western calculation, but in Chinese, I think I would like to get maintained about 19 to 25. So don't get overweight. If you can do these 4 things, I myself add 2 more things. Number one, eat a balanced diet, more about 90 to 100% vegetarian. Number two, reduce unnecessary stress. According to the statistic, they have been followed, I mean, they didn't mention how many years. They say you can reduce all kind of cancer by 40%. And then you can increase the survival of the cancer patient, over 50%. You can practically reduce the lung cancer by 85%. That is a very, very significant statistic. So all these things, you don't have to spend much money beside the alcohol. So I myself did not drink. I myself did not smoke. Have I ever been smoking before? Yes. I smoked 1.5 packets a day when I was an intern. In 1968, the June 30th, when I arrived at Akron Canton Airport, my chief resident, who is a Cuban Castro, his name is Castro, he smoked a cigarette. Of course, the Chinese always stretch your hand. So he gave me a cigarette and light it for me. Only one word he told me about it. Dr. Chen, you make your own money, you buy your own cigarette. I feel so embarrassed. I just one puff, throw away. Since then, I quit smoking. So I never smoked again. So at that time, one pack of cigarettes, 28 cents. Now it's over $8. So I'm very proud because I'm doing a lot of surgery. I did not want my patient to smoke, and I did not want my patient cough because the wound can be affected. So I always tell my patient, did you see the Mercedes? Because I quit smoking. That's why I buy Mercedes. Of course, now it's a Tesla, right? So I changed my car. That's it. Do you think it's easy to quit smoking? No, not easy. But your surrounding, everybody smoke. I hate people smoke. So I tell my patient, so when you like to smoke, I give you a chopstick. At that time, we had ivory chopstick, a very good one. I give you a pair. It's a good friend of mine. He's about 270 pounds. He want me to do gallbladder surgery. At that time, no mini invasive. So I tell you, if you can quit, you can quit smoking, and I can cut your surgeon fee to half. So he said, I cannot quit. I said, every time you quit, you buy the chopstick. So I give you a pair of chopsticks. He quit. And he's doing very good. After the surgery, he's doing very well. So he engraved that the ivory, so it becomes a souvenir. So at that time, I never had the mind. I should get a patent to see we call Chen chopstick, how to quit smoking. I never think about it. But that is how if you had a will, you can succeed it. But it's difficult, not that easy. Okay, the same thing to smoking. So somebody gave me Qingdao beer, 3 years, still my refrigerator. I did not drink Coke. I hate Coke, and I did not like a commercial. All right, but I like the McDonald's French fry. Like Dr. Stephen Tang know that. But that is one of the few things I did. So maintain a healthy lifestyle. You don't have to spend a lot of time, a lot of money. Okay? Any time left? No? Okay. 4 minutes. Okay. I want to tell you one more incident. So it's very benefit for you. So because I do a lot of research about GERD. I talk a lot, many times, GERD and esophageal cancer. GERD is a very common symptom. We call it gastroesophageal reflux. It's one very simple thing. So after you eat, we try not to eat. In Chinese saying, any saying we say, in the morning, breakfast, you eat good, right? Lunch, you eat more, right? Evening, eat less. I did not recommend that people eat after 9 o'clock. 3 hours before sleeping. So what do we do? So for me, about 4:30, 5 o'clock, we eat. And then bring your sweetheart, go to walk, to the park to walk. Half hour, 45 minutes, hand in hand. When two of you walk in the park, what are you gonna do? Tell me what you're gonna do. You talk intimately, right? Oh, kid, how you make money, etc., etc. Then number one, After eating, you walk, they will stimulate your gut, GI tract. So a lot of time I go to walk, I fart because my bowel begin to work. This is number one. Number two, to stimulate your stomach working, and then you digest food easier. So there's food stay in the stomach less. Okay. The third, two of you talk, have you exercise, you want to walk a little fast, it's good to achieve your daily exercise. And you talk a little intimate. After that, when you come home, go to sleep and enjoy quote unquote, I do not want to say anything, enjoy quote unquote. That's it. You don't have to spend any penny, which you can cut down a lot of unnecessary medication. That's what I try to tell you. That I'm doing now, okay? So you see, my weight is losing. So everybody know I do not eat very much. Because my age, my brain is shrinking, my belly getting bigger, why should I eat more, right? Make no sense. So everybody say, let's save half of it. But anyhow, don't overeat. And everybody talk about good. We had a very good lecture last week about talk to your diet, you know, but you have to eat it wisely. Not everybody can eat everything, but you eat balanced. Another last word. You know, one of the Denmark dietitian. You know what is the best diet? The best diet is to you get it from your own garden. Put it down in your kitchen and cook it yourself and bring it to the table. That is the best diet you're going to have. Number one, homegrown, no insecticide, no pesticide. Number two, it's fresh. Whenever anything you get out of it, right away you oxidize. No matter how well preserved you are, they become oxidized. So the best way to do that. But you're living in an area is fine. You got a place you can grow. But in the city, you can't. You cannot. Okay? There's the best diet here. It's very simple too, right? The last thing I want to see, everybody had a little piece of the glen, you know, the garden. So when you get upset with your wife or your husband, don't throw out anything. Go and pull all the weeds. The more you pull the weed, the better you are. Okay? Okay, I stopped my talking. I would like to get the video and turn it to the Northeast region, Mei Jian Sijie. I think he's in Taiwan.
Hi, can everybody hear me fine? Can everybody hear me fine?
Yes, we can hear you.
Okay. Hi, everyone. Oh, I should say 上人, 金色师傅, and everyone, good afternoon. This is Sherry Xi from Northwest region. Today, I'm going to share with you for the Tzu Chi Chinese Dialysis Support Group. Next. The reason why we established the dialysis group for Chinese-speaking audience, because most of the dialysis patients, they spend their time and also the energy for dialysis, so they don't have a social life. Second, they cannot find Chinese-speaking dialysis support group. Our members are including doctor, attorney, all kind of the profession. Even they are high educated, but they still, deserve to talk in the mother language with the person have the same illness with them. What we offer is we offer the update information and the resource, and such as the update medical information, daily care, diet and the nutrition, insurance resource is extra. And we also offer a place for patients to share their experience and also special case assistance. How can we do that? We meet regularly starting from July 2005. This support group has been 15 years, and we meet every 2 months. Next. During the pandemic, our support group still meet every 2 months by Zoom. The previous 2 meetings are July 26th. We have the meeting topic in the update of artificial kidney development. And the second one is on September 20th, the topic of at-home hemodialysis and peritoneal dialysis. Next. Today, I'm going to share a story about one of our special case assistants. Mr. M come from China, was unable to register for his kidney transplant due to the language barrier and had no family support here in the United States. Our volunteer accompanied Mr. M to the hospital to meet with the transplant coordinator and the social worker. This arrangement helped to assure Mr. M with the appropriate translation and a daily care assistant in order to get his kidney transplant operation. Next one. After the kidney transplant, our volunteer assistant with 1, food preparation. We have a local volunteer prepare the food for him. 2nd, daily health condition follow-up. I call him every day to check on his blood pressure, his blood sugar, and even the stove and the urine amount in order to communicate with the transplant coordinator. She called every day to follow up, all the condition. And 4th, communication with the hospital pharmacist to help adjust the medication dosage. The pharmacist worked very close with me and, try to understand his condition. Then she can adjust the dosage probably every few days. And the 5th, accompaniment to the hospital for return visit and assist with translation. Next. 6, communication with hospital pharmacist monthly for verification to refill the prescription. Daily care questions. 7, solving the problem from day to day, including medical issue, medication dosage, daily care questions, and the prescription refill. Next. For example, during the pandemic, Mr. M experienced great pain on his arm, which kept him awake during the night. Since he was on anti-rejection medication, he was not willing to visit the emergency room with his compromised immunity condition. Immediately, appointment with his kidney doctor was difficult to secure during this pandemic. While we continue to help him to make the appointment with his specialist, we refer Mr. Moon to our traditional Chinese medicine team, who treat him immediately and solve his pain problem. Next. The impact to the patient. According to Mr. M, this group has changed his life. Without Tzu Chi, he probably would not have survived well. Mr. M learned about Tzu Chi, great love. He is also willing to help others. He joined our team to be a volunteer. We wish to let more people know about Tzu Chi and spread the great love around the world. Next. This is the photo we take when Mr. Moop returned to his home, and all the volunteers who take care of him. We just celebrate the reborn of his life, and you can see how happy he was. Next one. I really thanks to the support from all volunteers to make everything happen. Without a volunteer, we are not able to make all of the care for Mr. M. And we have a more example like this. Many of the people need our help. So it's very grateful to the support from.
Sorry, sister, I think you need to mute.
Can you hear me?
Yes, we can. Yes, now we can. Yes, thank you.
Oh, okay. I'm sorry. So, which part I miss?
Just literally last 5 seconds, so we didn't miss much.
Okay, good. I really want to say thanks to all the volunteers who helped me to take care of the patients. And I wish more branches set up the dialysis support group to help Chinese-speaking patients. This is my sharing today. Thank you much. If you are interested to set up the dialysis support group to serve the Chinese patient, please let me know.
Okay, thank you, Sister Sherry. We have been a comrade for the team yearly meeting for many, many years. You are always a very good cheerleader too. I appreciate you shared the dialysis patient for us. The next speaker, we would like to invite the U.S. Northeastern corner, the region of the Dr. Tsai Xinlan, who is the I believe he's an occupation therapist or physiotherapy. He's the one take care of me when I get sick in Mexico. Sister Xinlan.
Hi, everybody can hear me? Okay, I don't know if you can see me, but that's okay. My name is Xinlan Chen. I'm a physical therapist working in a hospital in Long Island. So I'm in a team member on Long Island group. Okay. And I have also been a Tzu Chi commissioner since 2011. So I'm very honored today to present this section on behalf of the New Year chapter. Since the pandemic, so we have also have a multiple project going on in New York. Because the pandemic, we regularly having COVID-19 seminar about vegetarian eating, mindfulness, and infection control. And today, I'm going to present it about New York chapter's ongoing project. So because this one we already mentioned in the morning during our report. Okay, so the first project, we're doing the Alzheimer's workshop. Okay, so Alzheimer's dementia actually is in America, as the like 5.8 million Americans in all ages are living with Alzheimer's dementia in 2019. And Alzheimer's disease is the sixth leading cause of death in the United States. And it's also the fifth leading cause of the death among those who's age 65 and older. And it's also a leading cause of disability and poor health. And you can see on this slide, 1 in 3 of the senior will die in Alzheimer's or other dementia. It's more than combined with prostate and breast cancer. So it's really costing a lot in our healthcare system, but it's not fully aware among our population. So we've been working together with Alzheimer's Association since 2018, and we're regularly holding the Alzheimer's workshop. Like 2019, we have in-person, multiple days. But since the pandemic, we've been moving the workshop online to the online webinar. And so the purpose of this education program is to help to raise awareness and to promote brain health and provide support to those who are affected by this disease. And our goal has been working with the Alzheimer's Association to educate our aging population and increase their concern and awareness, as well as increasing, community engagement in the dementia research, and to train volunteers for spatial care and support services. So this is the first project. And the second one is we're working on connecting with minority communities. So since the pandemic or even before, we have been holding food pantry for underprivileged populations, mostly minority communities. So in New York, the majority of these recipients are members of the Spanish-speaking community. In order to carry out our mission, we have been working closely with them. So we use our vision program, like we mentioned in the morning, that we have a vision mobile van, and we use our vision program to provide vision care. We're also hosting free clinic and outreach program, and to recruit more volunteers from diverse communities. And so
Y yo le agradezco a Sushi porque sé que nos van a continuar ayudando.
I'm glad I work with them. If they need us, we are back each month for them to do the distribution.
Hermana migrante, todo estará bien.
Okay, so that's the video that is the food pantry in New York. And also the picture you showed it on the right-hand side, this is a picture. We have the food distribution in Long Island office, and we're having the Spanish speaker volunteer help promoting vegetarian eating. So in our Vision Mobile plan, we're required like 25 volunteers who will require Spanish speaking and English speaking, and they will assist to discover patients who require vision care. And all these volunteers will require to attend Vision Mobile training, and our volunteer will help to set up patients pre-screening and scheduling. And so in the short term, that we will cooperate with the charity team to bring food pantry and our Vision Mobile program to the minority community. And hopefully during this process, we can recruit more Spanish-speaking volunteers. And in the long run, we're planting the seed of the Tzu Chi spirit to all minority communities. So this is our project for the healthy community. And the last project is one that's been going on in New York chapter for quite some time. And our Dr. Kenneth Liao is the one who proposed this formation of the biking group to promote healthy lifestyle and coexist with the earth. And the New York Bike Group has been attending New York 5-borough bike tour since 2014. And we're doing to promote health and fundraising for Tzu Chi at the same time. So during the pandemic, we have all come to realize that our body's best defense against the virus is a strong immune system. That's why exercise is extremely important. So this is a little video I would like to share.
这个世界能够有救，但是我们除了有善念、有爱心，最主要是把自己个人健康一定要照顾好。所以更坚定我在这医疗方面更要做所谓的保健的工作。
新的生活的形态呢，我想应该是低欲望的生活。可以着重于自己的健康，多接近大自然，找到一个人类跟自然的一个等号。
康复之后呢，能够成为他们就是在这场仗义里面的一个导师，然后给他们一个方向，那不要放弃，然后能够勇敢的面对的话，这些困难都是可以克服。
身心灵健康。 乐观的话，就不会畏惧，自己医疗人员也会自己保护好，利他帮忙人家的时候，这种的回馈是无价的。
I would like to thank all the 3-in-1 group and to recording this series about our story during the pandemic, and thank you all for listening for my presentation. Thank you.
Bravo.